What's up, what's up? It's your girl Marilyn Miller,
Daria Caballero.
and we're bringing Candida Albicans to you.
When you walk my way, hope it gives you hell, hope it gives you hell. Now where's your picket fence, love? And where's that shiny car? And did it ever get you?
So what is this pathogenic microbe, Candida albicans?
Candida albicans can take on several different forms, primarily yeast, pseudohyphae, and hyphae. For its pathogenicity, its ovoid-shaped budding yeast and parallel-walled true hyphae forms are the most important. The hyphae form is more prevalent for an infection, while the yeast form is believed to be important in the spread of Candida albicans. The role of pseudohyphae is not very well understood, other than being an intermediate form between yeast and hyphae.
The ability for Candida albicans to switch from different phenotypes is spontaneous and reversible. In one form, the microbe is white, round cells with smooth colonies. In the opposite form, it's opaque, rod-shaped, and flat gray colonies. Antigen expression is also changed as the two forms have affinities for different tissues. So where is this fungus found?
It's found worldwide, but most commonly affects immunocompromised individuals diagnosed with serious diseases like HIV and cancer. It's also responsible for 50 to 90% of all cases of candidiasis in humans. It's found in normal parts of your gut flora and usually lives peacefully with other bacteria and yeasts that live in your digestive tracts.
Candida albicans can be found in your skin, mouth, genitals, blood, but is most commonly found in your intestinal tracts.
When it affects the mouth, it's called an oral thrush and is characterized by a creamy white coating or patches.
When it affects the skin, it leads to rashes, blisters, and it shows mostly on skin folds.
Vaginal yeast infections cause itching and a white cottage cheese-like discharge.
Candida albicans can change back and forth between its hyphae form and its yeast form depending on its needs and the environment around it, allowing it a high adaptability rate, which allows it to live in a wide variety of different conditions.
Causes: sugar consumption.
Candida cells feed on sugar, sugary soft drinks, and desserts. Give Candida just what it needs to expand throughout your gut.
Stress.
Rises blood sugar levels and damages your immune system by weakening your adrenal glands. Birth control.
Estrogen, the main ingredient in contraceptives, is known to promote the growth of yeast cells. Normally, your skin acts as an effective barrier against infection. However, any cuts or breakdown in the superficial layers of the skin may allow the fungus to cause infection. Candida becomes pathogenic or capable of causing disease when conditions are favorable for it to multiply. So, hot and humid weather, poor hygiene, or restrictive clothing may produce these conditions. Those aren't the only risk factors to consider. Candida infections also tend to be more prevalent in infants, people who are overweight, people with diabetes, people with an underactive thyroid gland or hypothyroidism, people with inflammatory disorders, people with a weakened immune system, people working in wet conditions, and pregnant women. The major waste product of the yeast cell activity is acetaldehyde, a poisonous toxin that promotes free radical activity in the body. Acetaldehyde is usually broken down into acetic acid within the liver. However, if this process isn't working efficiently, then it can circulate through your body and cause unpleasant symptoms like headaches and nausea. Candida can make you drunk. One of the primary byproducts of Candida's fermentation of carbohydrates is alcohol.
Alcohol levels can be so high that the individual may feel and appear drunk, fail a breathalyzer test, and experience a hangover after the sugar or carbs have left their system.
This phenomenon is called autobrewery syndrome, and it can lead to cravings for alcohol that advances to alcoholism or can perpetuate alcohol addiction in an alcoholic. So if you have a sinking suspicion that you've got candidiasis or any kind of yeast infection at all, you've gone to the doctor to get properly diagnosed. So once you get diagnosed, how is Candida treated? How we gonna get treated?
By treatments.
Just kidding, antifungals, but how do they work?
They work by destroying the cell walls of the Candida cells. These include treatments by prescription or various home remedies.
Popular prescriptions include diflucan, which is considered to be more of a fungicidal, which kills the fungus.
Nystatin, a fungostatic medication which is more focused on stopping the cell growth.
Or amphotericin B.
So what if I don't have enough money for these prescriptions or medications?
You can use home remedies. One popular home remedy is to use garlic. Garlic has a number of sulfur-containing compounds that give it natural antifungal properties. You can have 2 to 4 crushed garlic cloves daily or take supplements. You can also apply raw crushed garlic cloves to the affected area every day.
Another type of home remedy is using coconut oil. It works as an effective remedy due to its medium-chain fatty acids. Studies have shown that these saturated fats have antimicrobial properties that help kill Candida without leading to the development of other strains of Candida.
You can eat yogurt too. Probiotics present in yogurt, especially with live cultures, are helpful in fighting off candidiasis yeast infections. The Lactobacillus acidophilus culture, in particular, keeps Candida in check by producing lactic acid.
Another home remedy is to use apple cider vinegar. It helps restore the body's natural pH balance, rich in enzymes that regulate presence of Candida. It creates an unfavorable environment for fungi and encourages healthy gut bacteria to balance the flora into your intestinal tract. Overgrowth of candidiasis can range from a mild skin rash to a severe infection of the blood.
So what is Candida albicans?
Candida albicans.
So what the heck is Candida albicans? That's going in the freaking bloopers, dude.